Welcome to your upper-level rotations in pediatric hospital medicine. This video reviews the expectations for upper-level residents on PHM. To begin, it is important to remember that patient care and supervision responsibilities increase as you progress through residency. Prior to starting the block, you need to get a handoff from the previous upper-level resident. This handoff should include patient information as well as information on intern and medical student progress and what goals they are working towards. In addition to watching this video on our YouTube channel, please watch the intern expectation video to help prepare for your supervisory role. Ensure the interns have watched all the YouTube videos to prepare for the PHM rotation. Let's break up the responsibilities by time of day. At 6:30 a.m., you will meet the resident teams on the 6th floor of the resident area and oversee the patient handoff in iPass format. Help divide the patients fairly amongst the interns. Consider patient acuity and be mindful of intern clinic and didactic lectures when assigning patients. Remember to obtain a vocera from the 7th floor workroom and ensure that the interns also have a vocera. Following the morning handoff, if there are new interns or medical students on the rotation, please help orient the new learners to the rotation and hospital. You may need to review expectations for patient care, how to enter notes and orders, as well as using Meditech and PACS. For learners new to the hospital, you may need to show them where things are located in the hospital and how to find certain people. Between 7 and 9:30 a.m., prior to rounds, there are many supervisory tasks to complete. The major goal of this time is to prepare for efficient, high-quality rounds, which will lead to a more successful day. You first need to review the patient list based on your handoff and round independently on the watcher status patients. You will need to assist in patient care as needed during this time. You may need to assist interns with calling morning consults. As the supervising senior resident, it is extremely important to know all the team patients. Review all vital signs, labs, images, and tests for each patient. Prior to rounds, touch base with each intern and review patient assessments and plans to help ensure that your interns are prepared for rounds. For early discharges, please review all discharge orders, discharge instructions, and prescriptions. This is a major potential patient safety hazard, so please review all prescriptions prior to discharge in order to catch any errors. Before rounds begin at 9:30 a.m., make sure you know which nurse is assigned to each patient. This will make rounds flow more efficiently. As the supervising senior resident, you have a teaching responsibility on the team. Before rounds, you also will need to plan and develop learning topics that you would like to cover for the day. Remember that learning topics should not be lengthy and that in-depth discussions are better suited for afternoon teaching. Review your teaching plans with your attending prior to starting rounds. Teaching topics that you could incorporate into rounds include selected portions of algorithms and clinical practice guidelines, interpreting radiographic studies, differentials of lab abnormalities, abnormal physical exam findings, differential diagnoses, and clinical reasoning discussions. When we have a clerkship student, who will be a second or third year student from Baylor, please review all of their notes and provide feedback. They will be writing SOAP notes on blue progress notes. When we have a fourth year medical student, you will see the same patients as the student. You will be responsible for reviewing the student's exam and note prior to rounds. You will write the progress note for the patients followed by the fourth year medical student. Fourth year students have the ability to enter orders in Meditech, which will need to be co-signed by you. Please review the orders, ensure it is accurate, and sign off on it. The order will not become active until you sign it. In order to have a successful, efficient round between 9:30 and 11:30 a.m., have a plan for what room to start with on each floor. You should also have a plan for who is entering orders on rounds, which can either be entered on the WOW or on a patient room computer. You will broadcast on vocera to the rounding group, when you leave each floor so that nurses on the next floor are prepared for rounds. Ensure that the team keeps moving efficiently. Be a timekeeper. Understand that some patients may require extra time. You should have a plan for which patients can be skipped on family-centered rounds when volume or acuity are high. In each room, at the end of the intern presentation, you should summarize the information for each family. Please remember to be brief. You don't need to repeat everything that the intern just told them. During rounds, consider allowing your interns to work on patient care and care coordination, particularly if they are away in the afternoon. You do want to ensure that the interns keep a balance between completing work and seeing the other patients on the team, particularly patients with high-yield learning opportunities. Make sure all interns are engaged and learning about the patients on rounds. As the upper-level resident, it is your job to identify and assist when intern is struggling with a presentation on rounds. During the brief period of time between rounds and noon conference, ensure that patient tasks are being accomplished in a timely fashion. These tasks include orders, calling consults, and notes. This is a good time to briefly run the patient list to determine what tasks are still outstanding. Ensure interns leave voceras and pagers for protected educational time and afternoon didactics. If an intern will be late or not able to attend noon conference due to patient care, please remind the intern to communicate this with the chief resident. Afternoon conference, you may need to touch base with the team and run the patient list if you did not have time to do this after rounds. Assist in patient care as needed throughout the afternoon. As new admissions arrive, you will help distribute the new admissions among students and interns on all teams. Assess each intern's workload and afternoon responsibilities when distributing admissions. When a second or third-year resident are both on service, the third-year resident will be in charge of the distribution. Please ensure that all patient care is completed in a timely fashion, including orders, communicating with consultants, and patient notes. Remember to review discharge orders and instructions and prescriptions for all afternoon discharges. Before 5 p.m., update the patient list on Ingenious Med. Your interns can also update the patient list. However, it is your responsibility to make sure that the list is updated and accurate. In the afternoon, as time allows, review progress notes for chronic patients and PICU transfers and ensure assessments and plans are updated. Ensure follow-up notes are completed on patients in guarded condition, patients with worsening clinical status, patients with significant changes in plan of care from rounds, and all patients admitted after midnight. For new afternoon admissions, staff all new admissions with the interns and students to help develop assessment and management plans. After you have staffed the new admission, briefly update the supervising fellow or attending on the patient. Remember, if you are staffing an admission with a fourth-year medical student, you will need to write the admission note and sign the admission orders placed by the student. As time allows in the afternoon, all teams should conduct afternoon didactics. Try to have 1 or 2 topics prepared to discuss in advance. This is the perfect time to spend more time on a topic that would not fit in the time frame of rounds. These didactics should still be relatively brief, about 15 to 20 minutes, so that team members are able to attend without sacrificing patient care. If there is an upper level on green, this resident should coordinate and lead this teaching opportunity. Some examples of afternoon didactic topics include radiology rounds, pathology rounds, a discussion of evidence-based clinical guidelines, differential diagnoses, and an EBM journal review. After the evening patient handoff at 6:30 p.m., you will hold the admit phone and answer all phone calls. You may take all calls from our emergency room and the Westover Hills emergency room without the attending on the phone. For call center calls, answer the phone and contact the fellow or attending to take the call. The fellow or PHM attending will act as a medical control for the transfer. You should listen to the call as the attending receives the information from the outside hospital. Overnight, you will staff all new admissions with interns and medical students and help develop assessment and management plans. After you staff the admission, Briefly update the supervising fellow or attending on the patient. Please remember to review admission notes, including assessments and plans for new admissions. You should also review admission orders and review discharge orders and instructions and prescriptions for evening discharges. Provide feedback to interns throughout the night as you review these items. Please be available to the intern and medical student for questions about floor calls. Remember to notify the attending immediately if a patient deteriorates, a rapid response is called, or with any concerns. You will also help oversee completion of the night curriculum. Finally, remember to update Ingenious Med with new patients and major overnight events. It is most efficient to update Ingenious Med as you progress through the night instead of leaving all the list updates to the morning. At the end of the block, please ensure that all interns hand off their patients to the new intern starting the rotation. Ensure that their last progress notes have an updated hospital course section prior to leaving the rotation. As the upper-level resident, you should give interns and students mid-rotation and end-of-rotation feedback. In addition to the interns giving handoff, please give handoff to the upcoming upper-level resident. This should include not only patient information, but also information on intern and student performance and progress during the rotation. It is helpful to include what goals the interns and students are working towards during their learner handoff. Finally, have fun during these supervisory blocks. They can be some of the most rewarding rotations in residency.